The Auditor-General, in his reports on the expenditure of COVID funds, cited a number of infractions by the Health Ministry, including paying of vaccines that never came, facilities that were never used, amongst others, and gave some recommendations. What have the ministry done in response to those recommendations?
The sad aspect for this is that the auditors shouldn't have published work that has not been completed. We never got a management letter. We never saw any recommendations to respond to. Then they tried to publish. I think the Attorney General even issued some statement on that matter. That is not how audit work should be. Right? I sit as an accountant, and I was expecting that we'll get a management letter to try to respond to the issues that they have raised. That's never happened, but then it was published. So we have responded to all these allegations and issues and all that. The vaccines that we procured had never been supplied. Yes, vaccines had never been supplied, but we've got massive quantities supplied. That was done by the African Union architecture, right? So Johnson & Johnson at one stage couldn't supply vaccines, but we had to commit ourselves to it because when India closes borders and the vaccines we were expecting were not coming, we needed to do something. And that is how the African Vaccines Acquisition Trust got us into sign the contract for them to supply as a decision made by our president at the African Union, and Ghana couldn't opt out. And so that was a problem created, not by us, but by an arrangement that was being handled by the AVAT to ensure that we get vaccines on the continent. So that problem has been resolved. We've had inflows of these vaccines and refunds that they should have done. We are working with on it together with the World Bank and UNICEF to make sure that we get all our quantities and get all our refunds done.